begin with breaking news. And the World Health Organization says Israel has agreed to area-specific pauses in fighting in Gaza to allow a polio vaccination campaign to be carried out. It says the pauses will take place over 3 days in different areas of the Strip. Gaza's health authorities say they've recorded the first case of the debilitating disease in the Strip for 25 years. Rick Pieperkorn is the WHO's representative in the occupied West Bank and Gaza. He says more than 1 million vaccine doses are already in the Strip.
A two-round polio vaccination campaign will actually start on the 1st of September in the Gaza Strip. During each round of the campaign, the Palestinian Ministry of Health, in collaboration with WHO, UNICEF, UNRWA, and partners, will provide 2 drops of the novel oral polio vaccine type 2, so-called NOPV2, to more than 640,000 children under 10 years of age.
Kristen Salumi is joining us from the United Nations. So, Kristen, this is something that the WHO has been calling for. It's been saying that humanitarian pauses are vital for the polio vaccination campaign in the Gaza Strip. Tell us how this came about now.
Well, it came about after intense pressure from UN officials and the United States, with Secretary of State Antony Blinken also reportedly appealing to Israel to allow this campaign to happen. Also warnings that the vaccine could spread to Israel, as well as the expectation that it will spread rapidly through Gaza, given the lack of sanitation and the disruptions in medical care and vaccinations that have happened there, and the presence of polio now that was spotted in a young boy in the last week who's now paralyzed as a result. So what is happening is that the vaccines will be rolled out, as you just heard, starting on September 1st over a 3-day period. They'll start in central Gaza, and then they're going to move to southern Gaza for 3 days, and then to northern Gaza for 3 days. And they say that they've been given assurances by the Israeli authorities that if they do not accomplish as many shots as they need in those 3 days, that they'll be given an extra day in each of these places as well. So this has been very much an ongoing, intense negotiation. The UN has 2,000 plus workers ready to go to make this happen. They come from the WHO, as well as UNRWA and other organizations as well.
Did we get an idea whilst listening to that press conference of some of the challenges ahead? Because according to one spokesperson for UNRWA, who has been saying that, look, things like evacuation orders, for example, in the Gaza Strip are making planning extremely difficult.
Yeah, you know, we're talking to veteran healthcare officials here who've worked in combat zones before, and they say they've never seen anything like what they're experiencing in Gaza. It's just that challenging of a situation, given how much people have been on the move. Nevertheless, they say that while this is not an ideal situation, it is a plan that they can live with and that they're hopeful about. But there is a lot of uncertainty. For example, the vaccination campaigns are expected to last from early in the morning till early afternoon, from about 6 to 2 or 3 in the afternoon. That's when the ceasefire is guaranteed for. I asked the WHO official if that means that there could be violence after 2 or 3. Could the cessation of hostilities only apply to that early part of the day? And he said, well, we have certainly made it clear that we expect it to last for the full 3 days, 24 hours. But it's very vague. The reality on the ground is not clear. It's very uncertain. But he said that people in Gaza are aware of this, and they are working to get the word out even more about the need for these vaccinations. There's an estimated 615,000 children in Gaza right now, and also about how to get them and where to go to get them. So they are working in very difficult situations, considering earlier this week a WFP, a World Food Program convoy, was shot at by Israeli forces in the Strip, despite coordinating with Israel. That doesn't give a lot of confidence to humanitarian workers, but they're say that they're ready and willing to go forward with this plan.
Okay, Kristen, thank you so much for that update from the United Nations.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.